The back transporting points can also be used for the diagnostic purposes as they become tender on pressure or even spontaneously tender when the corresponding organ is diseased. The spiritual axis discusses this and other aspects of the back transporting points in chapter 51. The back transporting points for the center of the thorax is below the tip of the big vertebra. The do14, that is for the lungs, is below that is for the heart below the fifth vertebra. That for the diaphragm below the seventh vertebra, and that for the liver below the ninth vertebra. That for the spleen below the 11th vertebra, that for the kidneys below the 14th vertebra. All of them are situated 1.5 June from the spine. Soreness is relieved on pressing on these points. Moxa is applied on these points, never needling. In order to tonify them, one lets the moxa cones burn out on the skin slowly in order to sedate them. One blows on the moxa cones and then puts them out quickly. This passage establishes the use of the back transporting points in diagnosis when they become tender on pressure. The last statement could seem surprising as it forbids the needling of these points, which are needled so frequently in practice. The prevalent view is that prohibiting the needling of these points was an overcautious attitude so that they would not be needled too deeply. In fact, these points, and especially those on the upper part, should not be needled deeply. Because of the possible injury to the lungs, they should be needled quite superficially, but not just under the skin and obliquely towards the midline. Another point of interest in this passage is the mention of a method of moxibustion for drainage, contrary to the prevalent idea that moxibustion is generally used for tonification only. In addition to the above line of back transporting points along the bladder channel, there are also six other points on the outer line of the bladder channel on the back which are particularly important. So we have the bladder 42, door of the corporeal soul, level with bladder 13, which is the lungs. Bladder 43, the transporting points, level with bladder 14. Next is the bladder 44, hall of the mind, level with bladder 15, the heart. Bladder 47, door of the ethereal soul, level with bladder 18, the liver. Bladder 49, house of the mind, level with bladder 20, the spleen. Bladder 52, room of willpower, level with bladder 23, the kidneys. With the exception of bladder 43, the other 5 points exert a special effect on the corresponding mental aspect of each of the 5 yin organs. That is the corporeal soul, the pu of the lungs, mind, shen, of the heart, ethereal soul, hun of the liver, intellect, the yi of the spleen, and willpower, shi of the kidneys. The explanation of the acupuncture points says that these points are like a window, door, or gate. It says that the 5 yin organs are stored or hidden, but this can be seen from the outside at these points. These points can therefore be used in emotional and psychological problems of the relevant yin organs. It is strange that in spite of their names linking these points to spiritual aspect of the 5 yin organs, the old texts do not report many mental, emotional indication of these points. However, in my experience, these points do have a profound mental, emotional effect as indicated below. Bladder 42 can be used for deep emotional problems related to sadness or grief affecting the lungs. Bladder 44 can be used for emotional problems related to the heart causing anxiety and insomnia, in particular if due to heart fire or heart empty heat. Bladder 47 can be used to help a person find a sense of direction in life. It is very useful in certain cases of depression when the person feels confused and unable to plan his or her life. This is also effective to treat other emotional problems related to the liver, manifesting with mood swings, a feeling of frustrations, resentment, and anger. This point can both stimulate when the person is depressed or restrain when the person is manic, the movement of the ethereal soul. Bladder 49 can be used in patients who exceed in mental work or who are prone to pensiveness. Bladder 52 can be used for kidney deficiency manifesting with greater exhaustion, depression, lack of willpower, and feeling of powerlessness and hopelessness. Thank you for your attention.